Okay, so I'm sitting down with Steve and Anthony, who just presented our workshop on innovative benefit strategies as part of our HNIU series. So for people who couldn't make the event, what were you trying to accomplish with this topic?
The goal was to demonstrate to the audience the many emerging products and innovative ways that they can not only reduce cost but also improve benefit value for their employees. And we did a taste of 10 different topics in 3 categories that we intend to do further drill downs, deeper HNIU events later in the year based on the audience interest. But the core premise was that over 50% of the healthcare dollars that we spend is wasted. And so the opportunity is not only to flatten out costs, but actually reduce it. And we showed participants how that could happen.
Okay, so what topics specifically were covered?
We took our agenda and broke it into 3 different areas. We spent time talking about the primary care initiatives, things that really focus on what's broken within the healthcare system. Then we spent some time talking about incentive models, what can be done to change personal behavior. And then lastly, we finished up with talking about smart quality purchasing, things around focusing on improving benefit value.
So what primary care initiatives are out there that benefits professionals should be looking at?
In the time that we had, we introduced some of the emerging conversations around the patient-centered medical home. We talked about some of the things that are going on around the country with accountable care organizations, how they're emerging and how they're being developed, not only nationally but also here locally. Then we spent some time talking about on-site care, what that looks like in an employer setting, and the advantages that can be taken from that. And then lastly, we talked about concierge medicine, how to take that into an employer setting.
So the second topic you mentioned was incentive models. What innovative ideas did you cover in this segment?
This segment we talked about 3 different but interconnected ideas that really emphasize behavior change of individuals. The first one was what we call social wellness models, and really the content was focused on using existing social technologies to help people connect further to their communities around their health and to improve or at least maintain their health. The second topic was really about medical tourism, about the consumption side of healthcare, helping clients understand how they can direct their people to use transparency tools on cost and quality to really reduce cost and pay for efficient providers, and how employees can contribute to that. And the last piece is really using health incentive models. The health incentives live between these 2 ideas and are rewards for people for making the right behaviors. So that was the incentive topic.
Okay. So the final topic that you mentioned that you covered was smart quality purchasing. What does that mean?
We talked about value-based benefit designs, what's been going on in the marketplace, how that's been introduced, and how that can help focus the resources in the highest valued way to the employee population that needs those resources the most. We talked a little bit about some emerging technology and what's going on with telemedicine and telehealth, and what can we anticipate seeing in the future, and how that's going to be an advantage for a lot of employers, and how there may be some opportunities in the short run to take advantage of that. And then lastly, we talked about group purchasing and really focused on the idea of a group captive for self-insured employers that are buying stop-loss, and what that might look like if you were an owner of an insurance company instead of a purchaser of a healthcare product.
Okay, so do you have any concluding thoughts? What was the number 1 takeaway that you wanted attendees to leave with?
Well, the number 1 takeaway from this session would be that employers truly can control their destiny in healthcare. That 50% of the waste, if they can't erode it all, they can erode a large portion of that and truly reduce their costs if they take steps to actually innovate, to act on the many things that are available in the marketplace. And in keeping with HNI's tagline, if you're ready to change the game, we're ready to help you.